Hello, my name is Fiona Bengo, and today I'm going to talk about what I learned in social media in healthcare module. I'm going to focus on three parts. The first one will be the evolution of social media in healthcare related settings. Secondly, it's going to be the importance of social media in healthcare setting. And lastly, I'll talk about a framework that companies should follow as a policy for the effective use of social media. So to start us off with the evolution of social media in health related settings, so as you all know, in the past, social media was not being used a lot, but of late it has been used a lot by many people and many organizations. So a lot of organizations have been using social media just to spread out information or just use it for their own purpose. So for the ones who have been using social media, we found out this generation, which is called millennials or Generation Z, they expect and typically prefer digital customer experience. That's why they don't prefer the traditional method of getting information. So they would rather get an information in a digital wise manner. So that's why the healthcare settings have discovered this and made sure that they provide more information in the social media. So it has been found out that, in fact, 80% of adults in the US are using social media to look for health information online. So according to the Pew Research Center. So this means that a lot of people are using social media in order to get information about their health. So that's why it's needed that healthcare settings should use social media to make sure that those 80% of people are getting information about their health. So again, in 2017, there were more than 200 mergers and acquisitions in healthcare. This means that it's hard for them to communicate to them face to face. That's why social media now has been put in place to make sure that they are able to communicate freely and also reach to each other instead of taking a lot of time talking face to face, but they can still talk with each other in social media. So according to the 2019 State of Digital Marketing in the Healthcare Report, it was found out that only 22% of healthcare digital marketers are confident in using the web and digital tools to attract new patients. This is there because a lot of information about the patient has been maybe leaked, or the patient information is not confidential. That's why they are not confident enough about using social media. So that's why social media can not only be used, but also the traditional method can also be used to make sure that the patient information is safe. So that brings me to the importance of social media in a healthcare setting. So for the first one is raising an awareness. Social media can be used to raise awareness about a certain disease or a certain crisis that has happened. Like for instance, COVID-19, social media was mostly used to make sure that they get information about how to prevent that disease, how to prevent that pandemic. So social media can be used for that. The next one is combating misinformation. So this can be used by credible sources such as World Health Organization or CDC. They can use this to make sure that the information which are not facts can be cut off from social media. So this can help people to get the real information and not get the misinformation that people are posting. Another thing is answering common questions. So healthcare providers can answer common questions that patients have and make sure that they understand in clear details. So after that, I've already talked about that. So that information I got it from Newberry in 2020. So then lastly, I'm going to talk about the framework that companies should follow as a policy for the effective use of social media. So when using social media, there has to be a policy that the healthcare setting can follow. So the first one, the framework that I can give for the first one is employee access. Not all employees should access a social media platform. For that I mean the organization social media platform, because this can bring confusion, and if someone posts something wrong about an organization, then they'll be confused as to who posted and who did not post. So that's why there has to be a limit from the person who has to post it and the person who doesn't have a permission to post it. Then use of official accounts. If you're using an official account, you should separate it with your personal account. Official account is for official use and personal account is for personal use. Then for security, this is a grave matter, because if there is no security, then the information of a patient can be lost, or maybe they can't be able to protect the confidential information of the patient. And then now for the engagement, how often do you post updates about your organization? So you have to make sure that you post updates about your organization or any other crisis that can be needed. So in conclusion, I can say that social media is both good and bad for the healthcare settings. So the healthcare settings must make sure that they use the right procedure to make sure that social media affects them positively rather than negatively. So that was my time. Thank you so much.